Protecting your kidneys protects your entire future, because when kidney function starts to slip, it almost never stays just a kidney problem. It's more like the first crack in a dam. At first, the leak looks small, you feel mostly fine, maybe your labs are a little off, your blood pressure creeps up, you're more tired than you used to be, and then the ripple effect begins. Cardiovascular risk rises, bones don't remodel as well, hormones drift out of balance, fluid regulation becomes messy, and blood pressure turns into a daily tug of war. That's why kidney prevention matters so much. Your kidneys are the quiet engineers in the basement of your body, managing filtration, electrolytes, acid-base chemistry, and hormone signaling while you go about your day without thinking about them. So in this video, I want to give you a simple checklist you can start today, practical steps that help protect your kidneys for decades. And if you already have kidney disease, this becomes even more important because these same steps can slow progression, reduce strain on the remaining healthy filtration units, and in some cases, stabilize the trend. We'll go through 3 parts. First, medications you probably have in your cabinet that can quietly injure the kidneys, both over-the-counter and prescription. Second, a food framework, what to prioritize and what to limit if kidney health is your goal. And third, exercise. The types shown to not only slow decline, but improve key kidney-related numbers in many people. And the standard reminder, this is educational, not medical advice. So please talk to your clinician before changing medications, supplements, or a treatment plan, especially if you already have kidney disease, heart failure, liver disease, or you're on blood pressure meds. Now let's start with the most underestimated category, medications. Medication-related kidney injury is more common than most people realize because in real life, kidney damage often happens when stressors stack up. Someone is dehydrated, sick, recovering from surgery, fighting an infection, not eating well, sleeping poorly, and then a medication that's usually fine becomes the final push that tips the kidneys into acute injury. So let's talk about the major offenders, beginning with the one you can buy anywhere, NSAIDs, non-steroidal anti-inflammatory drugs. These are among the most commonly used over-the-counter medications in the world, and examples include ibuprofen, Advil, Motrin, and naproxen, Aleve. They work because they block chemicals involved in pain and inflammation, which is great for headaches, sprains, back pain, and joint pain, but those same chemicals also play a completely different role inside your kidneys. Inside the kidney, certain prostaglandins help keep tiny blood vessels open, especially when you're slightly dehydrated or stressed or sick, and they maintain steady, safe blood flow through the filtration system. When you take an NSAID, you block prostaglandins, which can make your knee feel better while quietly tightening the blood supply your kidneys depend on to filter. That doesn't mean never take ibuprofen. Occasional use is safe for many people, but routine use, high doses, long durations, or taking them when your kidneys are already vulnerable can become a problem. If you do need them, there are smarter ways to reduce risk. When appropriate, prefer topical NSAIDs like diclofenac gel instead of pills, use the lowest effective dose for the shortest possible time, and avoid the pattern of taking them every day for weeks. If you have chronic pain and NSAIDs feel like your only option, the safer approach is monitoring, regular kidney labs, and a clinician who knows exactly what you're taking. And here's the part that trips people up. The risk can rise sharply when NSAIDs are combined with certain other medications, especially ACE inhibitors, ARBs, and diuretics, because that combination can reduce kidney perfusion from multiple directions at once. Extra caution also applies if you already have chronic kidney disease, especially with significantly reduced eGFR, and if you have heart failure, cirrhosis, or you're at higher risk of dehydration. Next are proton pump inhibitors, PPIs, medications like omeprazole, esomeprazole, and pantoprazole, often used for reflux, heartburn, and ulcers. PPIs can be extremely helpful, sometimes essential, but the concern is how casually they can become a permanent lifestyle accessory. Many people start a PPI for a rough week and then continue it for months or years without revisiting the reason. Even though these drugs often don't address the root causes of reflux, late meals, alcohol triggers, weight changes, sleep positioning, certain foods, or other medications, and there's evidence linking PPIs with certain kidney problems in some patients. So the mindset should be the same as NSAIDs: use when truly needed, use the lowest effective dose, use for the shortest duration that makes clinical sense, and if long-term use is necessary, let it be an intentional decision with periodic reassessment. Now, antibiotics. They save lives, but some can stress the kidneys, especially in higher doses, longer courses, dehydration, older age, or existing kidney disease. One commonly discussed example is trimethoprim sulfamethoxazole, often known as Bactrim, used for UTIs and skin infections. Sometimes it's still the best choice, but it's a reminder that antibiotics aren't neutral. They're powerful tools with trade-offs, so don't self-medicate, don't extend courses just in case. Stay hydrated unless your clinician told you otherwise, and if you're higher risk, ask whether kidney function monitoring makes sense during treatment. Now, before we move to food, I want you to understand why even tiny hits to kidney function can matter so much over time. Your kidneys aren't one big filter, they're made of microscopic filtration units called nephrons, each one a distinct workhorse that filters blood and contributes to urine formation, and together they help regulate blood pressure, electrolytes, and hormones. Think of your kidney like a massive company, and every Every nephron is an employee. When the company is fully staffed, the workload is shared and systems stay stable, but when some nephrons are damaged or lost, the body tries to keep overall function steady by pushing the remaining nephrons to work harder. Overtime starts, stress rises, and the job still gets done for a while, but the hidden cost is burnout. Over time, the extra pressure on remaining nephrons can accelerate wear and tear, which increases the odds that more nephrons fail, which increases the load again, and the cycle tightens. That's why prevention isn't about one big moment. It's about avoiding unnecessary strain so the staff you have can last. Now let's talk about the food framework. If kidney disease has a favorite disguise, it's normal modern living. Not enough sleep, too much sodium, too many ultra-processed convenience foods, creeping insulin resistance, blood pressure rising by a few points each year, and the quiet assumption that nothing matters until something hurts. But kidneys don't usually scream, they whisper. So this framework targets the biggest drivers of kidney decline: high blood pressure and metabolic dysfunction, especially type 2 diabetes. One helpful lever for many people with healthy or moderately healthy kidney function is increasing potassium-rich foods through fruits and vegetables, because potassium supports healthier blood vessel tone, helps the body excrete sodium, and supports blood pressure regulation. Great choices include leafy greens like spinach and kale, cruciferous vegetables like broccoli and Brussels sprouts, tomatoes and many legumes, root vegetables like potatoes and beets, and fruits like avocados, melons, citrus, kiwi, mango, and papaya. But there's an important caveat: potassium is protective when kidneys can excrete it properly. If you already have more advanced chronic kidney disease, potassium can accumulate and become dangerous. So if you have CKD, especially if you've ever been told you have high potassium, this is where individualized guidance from your clinician or a renal dietitian matters. The other mineral that can quietly sabotage your kidneys is sodium. If you want one nutritional change that pays off for blood pressure and kidney protection, sodium reduction is near the top, with many guidelines suggesting targets around 2,000 milligrams per day or less depending on the person, and sometimes lower for those with hypertension. And for most people, the salt shaker isn't the main culprit. The main culprit is ultra-processed food, packaged snacks, frozen meals, fast food, deli meats, and sauces that hide massive sodium loads. So the practical strategy is pattern recognition. Build meals around whole foods, use herbs, spices, garlic, and acidity like lemon for flavor, and treat packaged convenience foods as sometimes, not the foundation. This shift doesn't just help kidneys, it generally supports heart health and metabolic health too. Finally, exercise. The good news is you don't need to become a triathlete to help your kidneys. Kidney supportive exercise is less about intensity and more about consistency, because regular aerobic movement improves blood pressure, insulin sensitivity, inflammation, and vascular function, and modest increases in activity have been linked to slower decline in kidney function over time. Walking counts, brisk walking counts even more, and cycling, swimming, and light jogging can all work. The best exercise is the one you'll actually do consistently. A useful goal is sessions around 30 minutes when possible, because that's a common threshold used in studies showing benefit. But if you're currently sedentary, start smaller. 10 minutes after meals, 2 short walks a day, a gentle ramp up you can actually maintain. If you want to add an extra layer of protection, include basic resistance training a couple times a week, because maintaining muscle helps glucose control, and glucose control helps kidneys. So here's your simple checklist in one breath. Be intentional with medications, especially NSA, IDs, and long-term PPIs. Respect antibiotics and monitor when appropriate. Eat in a way that supports blood pressure and metabolic health. More whole foods, fewer ultra-processed foods, sodium down, and potassium-rich plants when appropriate for your kidney status. And move consistently, walking and other aerobic activity most days, building gradually, plus a bit of strength work if you can. Because kidney protection isn't one dramatic decision. It's a series of quiet choices that compound, like interest in an account you can't see yet. You're not just protecting filtration, you're protecting blood pressure stability, hormone balance, bone health, cardiovascular risk, energy, and the version of your future that isn't defined by medical limitations. If this was helpful, pick one step from the checklist and make it automatic today. Stay healthy, and I'll see you in the next one.